Functional family therapy is an evidence-based model that works with the whole family unit. Those eligible are families with youth age 11 to 17 who might be experiencing some dynamics related to mental health, maybe some behavioral concerns, and those families are eligible to participate in our services, and they go from 12 to 15 weeks for working families. The goal of FFT is really to work with families to keep kids out. So we know a lot of times that families have a lot of dynamics that might be presenting in their world, and we really work hard for families to come together and recognize that despite things going on, it's not about what's right or wrong, it's about how we do it different and how we can keep families together in their home communities. So a family would be referred to us and we would engage with the family. The really cool thing about FFT is it's a little bit non-traditional in the sense of we don't just stick to the 8 to 5. So we're willing to work with families at times and in places that work for them. So it could be in our office, it could be at their home, it could be a church in the community, really whatever makes the most sense for that family and at what time during the day it makes the most sense for the family. Working with the family unit as a whole has been really rewarding. I think one of the best outcomes is really when you start talking about what's going on with a family and you see this shift where everyone's starting to see things just differently, maybe more positive, and it really allows families the opportunities to come together and keep doing things together. Like families often work really hard for one another, and maybe the way they work hard just isn't working or it doesn't make sense. But really the beauty of FFT is when you can kind of put all those pieces of the puzzles together and have it make sense so that that family just does things differently in a way that's more beneficial for everyone. I love working with the families, but one of the things I enjoy the most about FFT sessions is coming to their home. Obviously when it makes sense for the family, but like I've gotten to meet family pets. Even though we work with youth 11 to 17, we can always introduce siblings if it is right for the family. So I get to meet everybody, extended family. And family is a kind of a loose definition. So it's whoever the family sees as family, we get to bring them in. And it's really been fun to be in their family's environment and just seeing how they are. Sometimes with services, when we do them in an office setting, you might see beige walls or we kind of sit up straight, but when we're in the home, I might be sitting on the couch, the dog might be right next to me, and I just get to become part of that family's environment versus them coming to me and becoming a part of my. How long does it take before change happens? It really depends. It could be 5 minutes into the first session. Sometimes change happens before we're even introduced, right? Like I would say that change starts the minute a family says, okay, yeah, refer us to this program. And so it's really fun to watch that evolution of change within a family unit over the 12 to 15 weeks. What I tell families is they know themselves best. And so what I really like about FFT or functional family therapy is giving the families the opportunity to be the experts of their own lives and their own families. And I'm just a tool that can help them do what they've already been doing just in a different way. I would tell them just to say, when in doubt, try. So open themselves up to the vulnerability of considering a program like FFT says you're already halfway there to maybe doing something different for your family. And so I would tell them to not hesitate to reach out to see if their family is eligible. And if it's not FFT, there's also a plethora of other programs that might be a better fit for their family.